Ceann Corlin, sorry for my earlier interruption of Deputy Tommy Pringle on the queue, the pecking order. Sorry about that, Tommy. It's amazing when you think it's less than a week ago when we had all the nurses, including the leaders of the IMO and the PNA in the gallery, Phil High and Peter Hughes, to discuss for 2 hours the nurses' strike, because we felt it was significant enough for this House to discuss the implications of it. And then after that we had, I think, one of the most amazing demonstrations of workers' power on the streets of Dublin on the Saturday. I reckon 50 to 60,000, and I don't think that that is overstating the mark in terms of the numbers that turned up. But one thing about it that I felt about it was that it very much reminded me of the repeal movement. And I was thinking about the role Simon Harris played in that, and how after we won the vote, again less than a year ago, some people were shouting "I fancy Simon" and carrying placards about how wonderful Simon was. And now Simon, no thanks, you were, Paul, I saw you. Simon himself is now at the other end of the agenda, and is probably one of the figures of disdain and disgust for this wonderful movement, because there was a feel of repeal from that march. The march was largely young, it was hugely feminine, and it was very international, and that really felt to me like the movement we'd been through repeal, and there was nobody carrying "I fancy Simon" signs. And here I want to distinguish between what I think goes on with this government, because this government pose themselves very much as liberals. They have a very liberal attitude to wanting to promote the very just causes of the same-sex marriage agenda, the repeal agenda, the rights, reproductive rights, the same-sex family rights, absolutely 1000%. But when it comes to the neoliberal agenda, they're as vicious as Margaret Thatcher or any of the rest of them historically were. And they have set out to try and break the nurses because they want to teach a lesson to all public sector workers. I want to preempt everything I say by saying it is for the nurses to decide if this recommendation is good enough for them or not. Absolutely for the nurses. But the issue here is for us to be able to state clearly, and I think this is going to become more and more a fact as we go through the next couple of years, that the public sector pay deal is not fit for purpose, and that blind adherence to it will guarantee that the core issues that it affected there remain ignored. And it's not just for the workers concerned, but it's not fit for purpose in terms of our public services and what we can expect to be provided from them. The view is put across, though, by many commentators that it is an outrage that nurses would get anything outside of that pay deal, and would bring ruination to the country if we paid them more than the measly award that's in the deal. But the rubbish and the hypocrisy that comes from the usual suspects really never ceases to amaze me. They go to great lengths to commission reports, and the conclusions tell us that there's no case for giving the nurses a decent pay rise beyond the constraints of the public sector pay deal, that there's no outstanding issues, that a decade after the sacrifices that nurses and others made, there's no crisis in the hospital. But I suspect that those shrill commentators, and indeed many of the politicians on the other side of the House, don't actually experience the pain, the overcrowding, the seriousness with which the health service is being grinded under, and which those nurses work under, because most of them would have private health insurance, and that would guard one against, wouldn't it, the chronic problems that the nurses are trying to highlight. So the key question here is not, for us at least, is not whether this recommendation is what the nurses want to accept or not. I believe it's not good enough, but that's up to them. But the key question for politicians is, will this recommendation and the measures contained in it deal with the chronic shortage of nurses and midwives in our hospitals? Will it recruit nurses, and will it retain nurses? And I think we can say conclusively, absolutely not. And if it doesn't keep nurses here, and we'll see the proof in the pudding over the next period of time, then we really do have to think about what sort of a government we want. The Minister and his cheerleaders, they say that there's no crisis in the system, that people aren't endangered in the system. Well, I learned a lot from Philny Hay listening to her over the course of the strike. And one of the things she did point out very well, very eloquently and very scientifically is that we work under a seriously dangerous ratio of patients to nurses. The recommended international best standard is 1 nurse to every 4 patients. California have a law, and I wouldn't hold California up as an exemplary social democracy, but they have an actual law that says it should never go beyond 1 nurse to every 5 patients. We work in a system that has 1 nurse to every 8 at best, and at worst 1 nurse to every 11. And much of that is also, the latter end of the scale is very much affected in the psychiatric services. And we have a Taoiseach, who himself was Minister for Health and now a current Minister for Health, who managed a system that watched the trolley crisis grow last year to 108,000 plus people on trolleys. They manage a system that, where nursing numbers fell by 6% last year, 1,754 fewer staff nurses in Ireland today than a decade ago. They manage a system where in the psychiatric services in the last 10 years, or 13 years, sorry, since Vision for Change was born, 70% of all beds in the psychiatric services have been taken out, with the promise that that would be replaced within the community, but only 36% of what was lost of that service was replaced within the community. So we now have a system that is in chronic crisis with very dangerous nurse staff or nurse patient ratios. But it is okay to endanger patients, and it's okay, apparently, Minister, to overrun the National Children's Hospital by 500 million, to have a procurement process for cervical check that results in a fiasco that we've witnessed. And it's okay for all of that to happen, but God forbid that you would interfere in a public sector pay deal that isn't working for the public sector, for the workers or for the people in this country who rely on those public services. You're ironically prepared to stick with that pay deal and undermine our ability to retain and recruit the staff we need. That results, for example, in shortages of beds in places like Lindara in Cherry Orchard, where most of the year half the beds are empty, and they are beds for adolescent children with psychiatric problems. We're happy to pay 100 million a year to agency nurses to bridge the gap in staffing than actually deal with the issues. And if I can go beyond health, we're happy to pay almost £1 billion a year to keep people in homeless accommodation, a combination of supporting rack rent and landlords, supporting hotels and B&Bs, but that never gets mentioned, the waste of £1 billion a year in the homeless industry. As I said, it'll be a matter for the nurses and the shop stewards, and we'll know in the next while which way it's going to go, whether they accept this recommendation or not. But if it isn't good enough for them, then it should never be good enough for us. And I think that when we see how they decide, and whatever they decide, they will have our full support and our continued support, both publicly and in our communities. It may mean, if they reject the deal, that there'll be an outrage and a howl from the usual suspects that I mentioned earlier, more guff and nonsense from some union leaders who should know better. But the public, the ordinary people who receive the services from the nurses, know and understand that a bad deal for them is a bad deal for all of us, because it doesn't contribute one iota to improving this most drastic health service that we have. So this motion also attempts to address another element of the crisis, and here I really am shocked at how the government are behaving with the Psychiatric Nurses Association and their paramedic and ambulance drivers. Myself and Deputy Paul Murphy put this up as a topical issue a little over a week ago, and your colleague Finian McGrath stood there and in his printed statement said to us that they concluded that the government will not recognise NASRA. They will not recognise this union. So get out from behind the HSE. It is not just the HSE that are denying the ambulance drivers the right to be in the union of their choice. It is also your cabinet and your government that are sticking by that decision. And that is most undemocratic, anti-constitutional and unbelievably right-wing, that your government would take that position and force 500 paramedics and ambulance drivers back onto the streets tomorrow and beyond. and has said before, but there's multiple unions representing paramedics and ambulance drivers. Most of them don't have 500 members. NASRA do, and they deserve that recognition. And if your government holds out on refusing to give it to them, then shame on you, because you are forcing another and further more deeper crisis in the health service. Lastly, I just want to pay tribute to the almost 40,000 nurses and the battle that they have put up in the last couple of weeks. And I think it was summed up best by one nurse on Morning Ireland when she said, "This is our Rosa Parks moment and we're not getting off the bus." And they may settle for this or they may not, but whatever they do, the fight for parity and equality within nursing in this country is by a long shot not over.
Very good. Now it's